This is not a dichotomous gun rights versus gun control issue. This gets us nowhere. And in fact, we've lost ground with increasing rates of gun injuries and deaths over the last couple decades.
Inside an OHSU conference room,
what we mean to say, most simply, is that we're using multi-layered, multifaceted approaches to understanding the multiple causes of gun violence.
Experts assemble, talking through the data points, the troubling trends, the solutions that are working, and what more needs to happen, all using a public health approach.
In the field of injury science, we often say injuries are not accidents. They're patterned, which means that they're predictable, which means they're preventable.
Dr. Kathleen Carlson leads OHSU's Gun Violence Prevention Research Center.
Sometimes it feels overwhelming, but we're trained here to take a scientific, strategic approach to overcoming things that feel insurmountable.
Among the group gathered, surgeons specializing in trauma and pediatrics.
Gun violence in children has increased dramatically. It is the #1 killer amongst all children.
An internal medicine doctor and psychiatrist.
Our suicide rate by firearm here in the state is 40% higher than the national average.
A Portland police lieutenant.
Even if we reduce homicides by 20-30%, we got a long ways to go to get back to pre-2020 numbers.
And Roy Moore.
I was a victim of gun violence. I come from that lifestyle. Very proud that I'm no longer involved with it.
Channeling his lived experience into change and support for shooting survivors and their families.
I know what it's like to be in that hospital bed, and that's why I do the work that I do. I understand the nuances of recovering from a traumatic event, but I also want to work with my people so I can heal that trauma.
Solutions and interventions proposed include safer storage for guns, separate from ammo, mental health holds, and protective orders, including Oregon's red flag law, plus more education and funding for further research.
Undoubtedly, there are many more solutions to this problem that we haven't tapped into yet and that we haven't tried.
Now, experts say there hasn't been any dedicated federal funding to study the gun violence and injury prevention problem for decades. Dr. Carlson told me that is by design because it was viewed as promoting gun control. Ashley?
Alma, thank you.